I am the State Volunteer Coordinator here at the Virginia Department of Health and the Emergency Office of Emergency Preparedness and Response, and I oversee our Medical Reserve Corps program. And let's see. Okay. So we're going to go over today the purpose and mission of the program. I'm not going to go into the depth of public health. That would take probably a half an hour into itself, but I really will focus on COVID-19. Give you the nuts and bolts of being a volunteer, what your responsibility is, how to use our Virginia Volunteer Health System, and then our learning management system, Virginia Train. So our program was actually developed because of 9/11. At the time, I was actually working in a volunteer center and answered the phone from community members and medical volunteers who wanted to help. And at that time, there wasn't a process or a system that would be able to funnel them in to meet the needs of their communities. Thereafter, the MRC program was created, and a system, which we call the Virginia Volunteer Health System, helps to register healthcare volunteers. Nationally, our program is a national program through the Office of the Emergency Management at the Assistant Secretary for Preparedness and Response, and all those wonderful acronyms of which are too long and I really wish they would do away with. But at VDH, our program is sponsored by the Office of Emergency Preparedness, and each health district has an associated Medical Reserve Corps unit. Some of them are regional MRC units, and the MRC unit coordinator might be housed in a neighboring health district, but we have an MRC unit that serves the entire Commonwealth. There is one that does, and we have 22 MRC units throughout the state. We're supported through grant funding, so we're not a 501c3. This is totally supported with federal, local, and national funding resources. Basically, our volunteers do anything and everything that's needed to support the Virginia Department of Health in emergencies and in non-emergencies. Our volunteers step up in countless ways to address any aspect of public health, and really our workforce help to staffing augmentation, workforce, our core of all the people that can run alongside of us. And I just can't even begin to tell you how wonderful it has been as we've started in this COVID pandemic response to see just the outpouring of love and willingness of people to come alongside of us. You know, we've never had to respond to such a large worldwide pandemic as this. And at the beginning of our marathon of COVID-19, it seemed very daunting, and I felt like I was drowning many days. But the fact that we had previous public health nurses and school nurses and state health commissioners all coming alongside of VDH, I just can't even begin to tell you how reassuring that is. So I thank you for becoming a part of our VDH emergency preparedness and public health team. Just to give you a few examples of what we do in non-emergencies, volunteers do health screenings out in the community. This is a health screening event that's in Virginia Beach for our homeless population. We do homeless counting of individuals every year in January, health screenings for our opioid epidemic out in the southwestern part of the state and throughout the Commonwealth of Virginia. Volunteers do a drug take-back event. This was actually last month. Volunteers collected over 5,000 pounds of unused medication, get them out of cabinets and out of the hands of potential people that would misuse them. We also teach revive training, which is how to properly dispense Narcan, and volunteers teach the training and dispense Narcan to the individuals that participate in the training. So some very big missions there, and so much more. I really encourage you to go back and look at us on Facebook, and you can see all the activities that our volunteers are doing, and actually I'm going to share a lot of slides here. But in emergencies, VDH is responsible for a lot of coordination. Although we do not provide all the services, medical, obviously that's hospital and healthcare providers, our primary care physicians and such, and dentists. And then we are focused on public health aspect, Mental health is Department of Behavioral Health and Developmental Services and private providers. Many of you probably have a community service board or a regional behavioral health authority within your localities. And then, of course, we all work closely with our emergency medical services. We are heavily involved in ongoing conducting a disease surveillance and investigations. You know, that's heavy with COVID right now, but we're also doing it for many other things. You know, I'm sure you're well aware of in schools, we'll be tracking norovirus and flu and all the potential diseases and outbreaks that we typically see. We'll have that on top of COVID. But hopefully, the good thing is maybe by wearing masks, we'll have less of that. That would be the hope, right? If more people are wearing masks and washing their hands, we hope that we'll have less outbreaks of influenza and other transmittable diseases all along our entire community, definitely in schools. And then our volunteers also support the medical aspects of emergency shelters, not only for hurricanes, but also for winter storms out in the southwestern part of the state. Our #1 reason for setting up shelters is flooding. Especially in the Hampton Roads area. And, you know, volunteers come alongside and help to do triage and provide and answer any concerns about providing first aid and such. So we have had several declared public health emergencies. Our first of which was our pandemic in H1N1, and Dr. Remley at the time declared that a public health emergency. We also had Ebola, of which volunteers helped to monitor people returning from other countries. Zika, did a lot of outreach, and then, as I mentioned, the opioid addiction public health emergency. So public health does a lot. I think most people don't understand the depth of everything that we do. For COVID-19 response, we have actually been responding to COVID-19 since February. Even before, we had our case investigation and the public information. We've been supporting our epi outbreak, our epi teams and their surveillance efforts. Infection prevention, testing, been supporting some medical surge and also starting on vaccination. I'll share a few pictures. So we have some retired physicians and actually, and of course nurses help us with contact tracing and epidemiology at the very beginning, working side by side with our epidemiologists before we could ever hire any contractors. Volunteers were the first people on scene to be able to help the local health districts. Many volunteers helped with our public information and continue to do so today. The Eastern Region Call Center has been established since March, and it's still staffed by MRC volunteers throughout the region. This picture is here in Alexandria, but you may be aware that Prince William school nurses really stepped up and helped out for the call center there with the Prince William Health Department. I think that was Manassas City school nurses. So if you're one of those, thank you very much. But we really have involved our nurses in many aspects of public information, as well as our general support volunteers and people that are just really willing to talk to individuals that have questions and try to steer them in the right direction. We have started to do infection prevention control at our facilities. We have volunteers that do our public health screening. So before individuals can come into the building, we have volunteers that will take temperatures, ask them the appropriate question, log that, make sure they're wearing a mask, and then they can proceed into the building. We continue to provide that across many of the health districts across the state. I believe in Henrico County, a couple of the volunteers have even been supporting some of the city buildings as well. Volunteers have also taught infection prevention. As you're probably aware, one of our greatest areas of outbreaks which have caused death throughout our communities is in our long-term care facilities. The accessibility to PPE was quite the scare early on with this response because we had a limited amount of PPE. What was even more concerning is that the healthcare providers that needed to use the PPE, especially in the long-term care facilities, did not know how to use it properly and were not fit tested. So they weren't wearing masks that really could work and had been fit tested to make sure they fit to their face. So we had volunteers teaching donning and doffing and proper wearing of PPE. Oh, There we go. And we have volunteers actually do the N95 fit testing. That might be something that you've been trained to do, or you would be willing to learn how to do. So you could fit test anybody else in your in your city, employees and such, to make sure an N95 fit them properly. We have volunteers that are trained to be able to do that and have been going out to many facilities, long-term care, healthcare providers and such, to make sure that their masks fit properly. And MRC volunteers staffed the very first drive-through COVID testing event in Henrico County at the fairgrounds in early April. The drive-through testing model is something that we use every year for our influenza testing. So it was very easy for us to adapt that model and use it for COVID testing. You're going to see some pictures here where we're also doing with flu. More than likely, depending upon the weather, we'll be using drive-through testing for COVID vaccine. But it may also be that because of the weather, we are doing some vaccinations inside. Typically, most of the plans evolve around school locations, either the parking lots or actually inside facilities. They've been pre-selected many schools for point of dispensing efforts. And so you may in the past be aware that we have done our influenza exercises within schools. This is another a community testing event working with the Centera Hospital. They set up their mobile hospital, their tent, their mobile ED tent, and we had volunteers that did community testing in the back of a parking lot at several hospitals within the Suffolk area. We have also done a tremendous, astounding, amazing effort of volunteers that have willingly gone into long-term care facilities with COVID positive patients and taking care of the residents of those facilities. You may or may not be aware, but often when the facilities get positive patients within those facilities, the staff members are also positive. They quickly have to quarantine, and it is pretty common that those facilities can lose between 20 and 30 staff members within a 24-hour period of time, and they are very quickly scrambling to try to fill those staffing positions. We have been very fortunate that we had volunteers to support that early on. We're finding that we have less volunteers to support the long-term care efforts now, just because everybody's back to work, and we're also working on COVID testing and other efforts and really preparing for our vaccination campaign. So we had a very large vaccination campaign with H1N1, but we of course prepare that our COVID vaccination campaign is going to be like none other. What is reassuring to me is that we practice and exercise this every year. So for us, setting up a walk-in, vaccination clinic in a school. This actually picture was at T.C. Williams High School, where we did a very large clinic. And it's nothing new to us. It might look different, but we've exercised it and have lots of practice. So for me, I kind of think about this really being game day. We've been practicing, but this is exactly what we've been practicing for. We have had volunteers help the local health departments with school immunizations. I know some of you have also worked with the health departments and maybe done small drive-up vaccination efforts, and appreciate it if you have. We've had volunteers assist with that, and they do every year. We actually have some volunteers that not only are assisting with the COVID vaccinations, but are helping with hearing and screening. And we have volunteers that assist with school physicals almost every year in Loudoun County. So we do augment, school health in several different ways. For our flu immunization exercises, not only do we do it in school parking lots, but in a lot of the rural areas, we do them in drive-through rescue squads. So I believe this, I don't know, maybe so rural. I think this was up in Chickahominy Health District area where they drive right through next to the fire trucks and they get their flu shot and you keep on rolling. I actually go every year. They do an exercise in Portsmouth in the community center, community college, and I get my flu vaccination that way. So COVID-19, we'll be able to take a lot of the concepts that we've been practicing with our flu vaccination exercises, where actually the vaccine that we give out for free for those flu vaccination exercises is paid for with our preparedness grants. So we use the money given to us by the feds to prepare, to give free vaccine to the community and to exercise our capabilities. And so we are taking the plans that we have had in place for many years. We've updated those. Our COVID vaccination plan has been approved by the Center for Disease Control and been returned back to us. Our local health departments are developing their own local health department plan, because every community is a little different. It looks different. The resources are different. So they're customizing that plan and buying the resources and trying to develop the workforce to be able to support these vaccination efforts, which will be tremendous. We need you. We need everyone. Public health does not have enough people to do the mission ahead of us. There is absolutely no way. I'm sure Joanna or definitely Janine will tell you, we don't have enough public health nurses in our local health departments, and the number of public health nurses has dwindled for years, and we've had positions that have been open that we've been unable to fill. So our volunteers are really, you will be a part of our workforce. What is great about having nurses, and especially school nurses, is I think for school nurses, I'd say especially, is because you have great skills in corralling a lot of smaller people into organized groups and working with some younger individuals. Maybe we may not be at the beginning be providing children vaccination for COVID. Hopefully at the end we'll get a vaccine to do that. But often when we're working with our community, sometimes we're speaking to people at lower education levels. And I think that you have a great skill set to be able to work with a lot of different types of community members from different cultures, different ages, and I think that's really a great strength that you bring to us. We have just as many, well, not as many, but a lot of support volunteers and a lot of husband and wife teams of volunteers. The wife is a nurse and she's brought along her husband, and he's going to help to direct traffic or hand out clipboards. So we need a little bit of everyone, and we have at least one of everybody that's on this list of a healthcare professional, and dentists and dental assistants. We have veterinarians. I have a wonderful veterinarian in Peninsula. Every year he works with the flu vaccinations. He actually has helped with our case investigation as well. So, all healthcare providers have experience doing triage and talking to people, finding out information and providing them with information, in addition to the skills of actually providing vaccinations. The pictured here is one of our MRC nurses in Portsmouth giving a flu vaccination to another one of our volunteers last year. That's why they're not wearing masks. Non-medical support can definitely come in the form of students. You see here there's some students there from a community nursing program, and they were helping to inventory all of our supplies for our point of dispensing. And we are probably in greatest need for interpreters. We're actually developing a statewide interpretation team. We've had requests for volunteers that can speak Nepali, Arabic, Korean, Chinese, definitely Spanish. So if you have that extra skill set, please indicate that in your application and let your MRC coordinator know, because we could really place you in positions that could best utilize that additional skill that you have. You're going to become a part, if you're not already, a part of a very, very, very large team. We have increased our numbers of MRC volunteers by 60% in the last 6 months. So we now have 17,361 approved volunteers, and of those, over 12,200 of them have completed an orientation, a background investigation, have taken the appropriate training so that they can deploy and support their communities. This is a very robust number, and it looks just amazing, and it is amazing, but understanding that that deployable group of volunteers is not available at all times of the day. We have some individuals that are only available in the evenings, and some that are available during the day. So, you know, it does take a very large group to fill smaller requests for volunteers, just because everybody else has other competing factors in their lives, and we certainly understand that. But we will continue to onboard as many medical and support volunteers as possible, because I think that our mission is going to be quite longer than we ever estimated, and we don't want to burn anyone out, and we want to make sure that the right people are in the right place at the right time to do good for the communities. So we have a lot of red shirts. Most of our MRC units have red shirts. Right now we have COVID-19 MRC shirts, and they're burgundy. I'm sure you've already seen some pictures of those volunteers. I've put up here the slide of the entire state, and wanted to make sure that you know who your MRC unit coordinator is as you have joined or will join your MRC unit within the area of which you live or where you work. So if you plan on only volunteering within the area of your school system where you work, so for example, you work at Manassas, but you live in Loudoun, what we prefer to do if you're going to volunteer in Manassas, that you join the Prince William MRC unit. So please make that association when you register. If you need that change, that's no problem. We can do that for you on the back end within the system, and make sure that that is pretty seamless. So the southwestern part of the state, Christina Morris has a very large area. Linnawisco, Cumberland Plateau, and Mount Rogers, all the way from Wise to, you know, Whiffle. And then we've got the near southwest, northwest. So near southwest is Mary Lou, northwest is Chris. Francis is in Loudoun, Fairfax is Paula, Arlington, Christina Crespio, Alexandra, Ianella, Prince William, Amy, Rappahannock and Rapidan is Jessica, Henrico, Chickahominy, and Richmond City kind of is co-coordinated by Kate and Alyssa. Johanna Hardesty is in Three Rivers. The Eastern Shore is Ellen Archer. Peninsula is Olivia. Norfolk is Summer. Portsmouth is Terry. Virginia Beach is Ellen Burgess. We have Tom in Chesapeake, Connor in Western Tidewater. Augustine Doe is in Chesterfield, and in South Central, which covers Crater, Piedmont, and Southside, that's Katrina. So we have a large group of MRC unit coordinators, and I also have a great internal team at the central office level that you may be working with as we help to process your application and to make you a deployable volunteer. Oh, my formatting got all messed up. All right, well, we have some basic member expectations, and I really want to make sure that they seem very simple, but that you follow them. Do not self-deploy. So if you hear from a coworker that there's an event in this area and they got an alert for it, but you didn't, please don't go and show up there. We are very selective and specific about who we deploy to specific areas. And by self-deploying anywhere to a hospital, shelter, or any place, for good reason, for liability reasons, we won't be able to provide coverage to you or ensure your safety. Please complete the required training when you're requested to do so. We'll be sending alert notifications. We want you to send those. If for some reason you can't make it to an event, please let your MRC unit coordinator or the person that has contacted you know, so that we can assign someone else. Maintain current information in the Virginia Volunteer Health System, which I'm going to show you how to do. Our really number one requirement, I think, is that you're passionate about public health and you're committed to helping your community. And finally, you're not only representing your community, but also understanding that you're representing the Virginia Department of Health, the Medical Reserve Corps, our state health commissioner, Janine and Joanna both take great pride in all of the school nurses and all our nurses across the state. So you are representing all of us. This has to be red and bold. Do not self-deploy. If you self-deploy, we will have to remove you as a volunteer. Any actions that you do when you self-deploy are your personal responsibility, not ours as a member of the MRC. Public communication. We have received more media requests and press than ever before. And if you are at one of the COVID vaccination events, perhaps you might be approached by someone in the media. There should be someone that's a public information officer at those events, and you should defer that media person to whoever you supervises you or to the public information officer. If that person's not on site, please contact your MRC unit coordinator. When in doubt, always ask. I have facilitated many interviews for MRC volunteers across the state. Also nationally, we've had volunteers on Dateline NBC and in maybe some very large media markets. So we'd be happy to facilitate that for you. It just has to go through an approval process. I don't think I probably need to tell you very much about HIPAA. You're all aware of our protected health information. When you are a Medical Reserve Corps volunteer, you're following our policies for protected health information. The fact that you interacted with someone at a clinic is even in itself protected health information, and we can't share that. We are very careful not to provide pictures of volunteers, pictures of patients receiving care from our volunteers, anybody that's at any of the events, to make sure that there's nobody that's identifiable as well. Our entire HIPAA and liability acknowledgement can be found on our orientation website. And Tanisha can put that in the chat box. You can download both of those documents, and they're probably also referenced in the handbook for your MRC unit once you receive it, or it's also on that orientation website and you can download it there. One of the most important reasons as to why to become a Medical Reserve Corps volunteer is because you will be provided with the same liability protection as any state employee. This includes the same liability protection that the public health, the nurse manager, the health director, anybody at the Virginia Department of Health has. We're not a right to work state, so we cannot provide workers' compensation. Our coverage, our risk management coverage has some allowances. We've provided some support to nurses who have accidentally gotten needle sticks from giving vaccinations, but thankfully that's really been the only injury we've had of our MRC volunteers. I think one of them was because a nurse was in the back seat with a child that was squirming around and trying to give them a vaccination. Probably should have brought the kid out of the back seat, but needless to say, accidents do happen. Now, that's with the patient information. We have access to your information that you put into the Virginia Volunteer Health System. We have a large team, as you can imagine, to manage over 17,000 applications. We have the local health departments have access, the central office team has access to your information and helps to manage it with you. It is your information, and we try to make sure that it's up to date, and we ask for your help to do that as well. And all that information is in our Virginia Volunteer Health System. So if you do not have an application yet in the Virginia Volunteer Health System, really need for you to go ahead, not right this minute, but I need for you to submit one as soon as possible. If you already have one, that's great. I hope that you've gone through the approval process. If not, you'll be contacted shortly by maybe even Tanisha, who's in the chat box. We'll probably have her follow up with all of you to make sure that you get moved along to our deployable volunteer status. So our system is web-based. You can access it on your phone or any platform. We really encourage you to use Google Chrome because it works best there, not Internet Explorer, which I think is about on the verge of extinction. But if you have not completed an application, you're going to come over here to the left side of your screen where it says register as a new volunteer. If you have completed an application, you're going to come over to the right-hand side and it says, please sign in and put in your username and password. If you ever have trouble logging in, you can click the trouble logging in button. You can reset your password. You can get your name and your social security number, or you can also email us using the contact us button and we'll be happy to help you. You have your own screen when you log in, and if you need to change your personal information, you're going to come over to the My Account button. When you click on that button, the screen's going to open up and show you very similar information that you saw when you completed your application. And as we go through your application, you know, I know people change addresses and email addresses frequently. So if you need to edit anything, you can come up to the top where it says contact information, click it, and then it's going to open up the entire screen where you filled out when you submitted your volunteer application. Any section in your application where you would like or can make edit to, you're going to see this edit button up here to the top right hand side where it has a little pencil and it says edit. You click that, then all the fields, I clicked too fast, there we go. All the fields will open up and you'll be able to enter in any additional information or change information. You can also upload your profile picture for your badge if your MRC unit coordinator has not already done that. This here is, of course, a fake profile, but a very important profile of my therapy dog named Zeus. And I included 3 pictures at the bottom to kind of show you an example of the types of pictures that we would want to upload in the system for your identification badge. We do not want pictures of children and really cute faces on your identification badge. We need pictures that have a solid background that are facing your front facing. And so the picture to the right was Zeus looking very cute in his bow tie with a solid background would be the appropriate picture to put into your profile. You can upload that using the select image option. You can also use that same option to upload copies of your licenses and certifications. I'll show that to you here in just a minute. The most important area for entering in phone information is the screen that says phone and text alerts. So that will determine where you receive your text messages about mobilizations and where you will receive your communication about VVHS. So about alerts. So if you only want to get a phone call on your home phone, then make sure you select both phone or voice. If you want to get both phone and text on your cell phone, which I highly recommend, choose both. You can add multiple phone numbers in here. I would say primarily everybody uses their cell phone. And text messaging really does, it gives us a great backup in case you didn't get an email. Also, some people have a hard time getting phone calls in different areas because of limited service. And the text messages just have a greater success rate of coming through in some areas where there's limited cell service. In our credentials section for both the identification verification, your DHP license, and CPR, you have the option to upload pictures. What is most helpful to us is if you upload your profile picture and your driver's license, some type of federally identifiable license that says who you are. That could be your military, it could be your passport, your DMV license. If you have that uploaded, we're able to do your background investigation without contacting you for any additional information. If not, we're going to have to contact you and get your social security number and other information in order to process your background investigation. So please do us a favor and upload both of those documents so that we can get that done for you. Oh, and the same for your CPR certifications. You can upload the document there, and then licensure you see here with your Department of Health profession. Now, the Virginia Volunteer Health System interacts with data from the Department of Health profession every evening. So we are constantly validating your licenses, and it automatically shows up and gives us the date of expiration. So enter it in, and we're going to be checking that every day. Your CPR certification, we cannot verify electronically, so we ask that you include as much information as possible. And if you do have a picture of that, please upload it as well. So, and I'm looking at, oh, I got 10 minutes. Holy cow! All right, we're gonna cruise. Do I have any leeway of going over a few minutes? Somebody can let me know. I don't have
Yes,
my
you
chat.
do, Jennifer. Yeah, you do.
Okay.
That's fine.
Thank you. I'm trying to move fast, but not miss the important parts.
That's important. Thank you.
All right. Yep. So our learning management system is Train Virginia. It has just a wealth of public health educational material from CDC and just all over. If you know, we encourage you to take anything that is of interest to you, but definitely the courses that we need for you to take. I've included the website here for Train Virginia, but gonna ask that you do not create an account with Train Virginia. Once you have an approved account in the Virginia Volunteer Health System, you will receive an account in Train Virginia. So that's automatically created for you. You can log in to Train after your account is approved by just going in and entering in your email address and asking for the password reset, and that'll get you logged in for the first time. We have instructions on how to access Train, and I'm going to ask Tanisha to put the training website in the chat box for you. It is a page that has all the different trainings. It has links to training. It has the Q&A on how to log in and train. Guru, Brad will help you if you need. So this allows you to pursue any additional training. Now, there are a lot of training that has CEUs. So when there's CEUs provided for courses, of course, that's very beneficial for y'all. So definitely take a look at the course descriptions. You will constantly always have access to your training records out of training, but you'll also have access to your training records in the Virginia Volunteer Health System. Like I said, don't go in and create a Train account. We are going to work on that for you. So in addition to this training, there's some other core trainings that we would really like for you to complete. The vaccination overview, Janine is going to do that for you on Thursday. For some reason, you can't make it on Thursday. We have all of those modules available to you online. That's what the other volunteers have completed and are completing. So you have either options there. With that, there is also associated quizzes that have to be passed in order to be checked off as having the knowledge, the vaccination knowledge for several different types of vaccine. I think there's flu, Tdap, and I don't remember which other one it is. HPV. I'm sure that Joanna can put it in the chat box. My brain is a little shot today. So you'll have to take quizzes. You have to pass those quizzes with 80% or higher. If you don't pass the first time, you can go back in and retake it. It kind of is an open book, so we encourage you to review the information out of the pink book and make sure that you feel comfortable answering those questions. But you're blessed to have Janine giving it to you in person, because you can ask questions of her then, and I'm sure it'll be a much more dynamic presentation than going in and listening to the CDC talk about each of the vaccines for sure. So in addition to the knowledge assessment for vaccinations, we have a skills assessment, and the skills assessment is actually someone watching you handle the needle and the safety cap and administering the vaccine. Those are done on site, either in advance of the clinic, or, I mean, like a couple days in advance, or actually prior to the clinic, maybe 2 hours prior to opening, we have a just-in-time review of how to use. Now, one thing I've obviously left off here is the COVID vaccine. We will have a specific module for COVID vaccination. We know that that is going to be a lot. It's going to be new to everybody. Nobody's going to know how to give this COVID vaccine. It has a lot of different, things that we're going to have to follow. It has to stay super ultra cold storage. It has to have, it has to be mixed, and it's going to be a little complicated. So we are going to have some specific training for the COVID vaccine. If you do not have a current CPR certification, we do have a scholarship for the American Heart Association for any of our volunteers to take the online didactic version of CPR. We are not providing the in-person skills assessment statewide just because of our COVID numbers. That really is dependent upon the local health district and their comfortableness with providing an in-person skills assessment. We do have the scholarship. You don't have to pay for it. We actually have a website where you can just go in and apply for the scholarship. We send you a code to go in and you take the information, you take the class online, and you get a certificate for completing the American Heart Association didactic portion, and then you can go in and do the skills assessment. I highly recommend that you take psychological first aid, not for yourself, but also in interacting with individuals. This is stressful for all of us. Individuals are going to come to these clinics to get COVID vaccine, and maybe they've had a loved one that's passed away. You might be interacting with other healthcare providers that are super stressed. They've been through this for a long time. Maybe you're helping us at one of our closed point of dispensing sites where we're going to be giving vaccine to healthcare providers that work in long-term care facilities or work in the hospital, and we're going to be interacting with them. And I think that we have to be mindful and compassionate that, we've all been through a lot, and those healthcare providers on the front lines, they're heroes. They're definitely public health heroes. And so we think that it's important to take care of our own personal and their psychological, emotional well-being. There is the website for all the training that you can find. If you go down to the very bottom, there's actually an accordion that'll jump out links to all kinds of menus. So encourage you to explore there and use that kind of as home base. This is when you go into your profile in VVHS, you have a training option and training report, and you can come in and see your information for training and all your courses that you have completed. I don't think I have. Yeah, I don't have a screenshot for that, but it'll list out all the courses you've completed, how many hours, and you can print that out. You can print it out by coming up to the PDF training summary. And so for some reason you need documentation of all the training you've completed, you can come in and complete that out. Print that out. You can also do the same for your deployments. So maybe maybe you're applying for a service award or something in your community, and you want to show how many hours you've given as a Medical Reserve Corps volunteer. You can also print that out in your deployments tab. So how do you get from this orientation to in the field providing support to the community? And really, it is a bit of a process, but the number one way that we communicate with you is through alert notifications in our Virginia Volunteer Health System. Just providing kind of a cliff notes of the different types of alerts that we send and what they mean. We send communication. It's just a newsletter. Awareness is heads up. Vaccines out. We're going to be providing training in the next 2 weeks. And provide some additional information. Please read up on this website. Readiness is we need to put together a schedule. We want to know when you're available. Activation is we need people to show up next week to do a COVID testing event. Emergency is it is a declared emergency, and I need for you to respond within a 24-hour period of time. And then deactivation is that you're no longer needed. You will receive an email for every alert notification that is sent to you. It will look like this. It'll have a quick little summary. Actually, this is a great example of some of the other public health work that we do. We have volunteers that help do health screenings and education to athletes with the Special Olympics. So a great outreach. And when you get the email, you're going to see there's a link there. It says, please click here to confirm receipt and select your availability. That's going to provide you with more detailed information about the event that we're asking you to be available for. Typically in a who, what, when, where, how format, and provide some additional information. If you're available for the event, you're going to come down and you're going to click, I'm available for this event. If you're not, it's not available for the event. Please click one or the other. Not responding is not helpful for us. And the coordinators have a secret button that if you don't click one of those buttons, they will resend the alert to the people that have not responded. So choose one of those and you'll never be notified about it again. Promise. Now, when things get more complicated, I can't imagine them getting any more complicated than they are right now, honestly. We send out alerts for multiple locations, multiple days, and multiple shifts and times, and also the different types of volunteers that are needed. So you'll see here, you might have a menu with many alert choices that you can select from. And it could be that you want to work at one elementary school or the high school. If you were available for both, you would click in the available button for both of them. If you could only go to TC Williams, you would click in TC Williams and you would click the blue available button. If you can't do any of them, just click red. It's all good. We just need to know. Other than email, you do get phone calls. Phone calls are you can respond available or unavailable to phone calls if there's only one option. If it is multiple locations, days, and times, then you're going to have to go in and check your email. You'll get a text message, but you will not be able to respond via text message. You will get a message on your phone. What I need for you to do is write down the phone number that I have in red, the 804-864-7200. That phone number is going to be the phone number that calls you if you get an alert. So please save it in your contacts so you don't think that we're a spam caller to ask you about your insurance on your car. Thankfully, hopefully we're all getting less spam because of the elections being over, but make sure you put that in there. You can just put MRC alert, and then when that comes through, you know that you need to answer it. We hope that you are available, that you want to be picked and you're qualified. If you're stressed with work and it's just not a good time for you, don't feel obligated that you have to say yes. We want you to go because you're ready and you feel comfortable and you can make that commitment. That's the reason. Remember, the reason why we have 12,000 volunteers is we know that not everybody is going to be available for everything. So we have a large workforce. So hopefully when we have a deployment that we need 200 volunteers for, we'll have all the volunteers that are needed. So, you know, if you haven't completed all the requirements for a position that you've been assigned for, or you signed up for, please let the person know when you arrive there that maybe you would like a refresher or you don't feel as qualified to do that job, and they'll make sure that you get the education you need to be competent to perform the position. Because we are in a COVID-19 response, we always like to remind people that if you're at high risk, you need to personally make that assessment and decide whether or not the assignment is appropriate for you. If you are high risk, we have a lot of volunteer opportunities that don't require interaction actually with the public. Contact tracing, case investigation, packing supplies for our clinics. A lot of that does not require public interaction. And, you know, so you have the option to serve in lower risk positions. We will always provide you with appropriate PPE. Janine actually is one of our safety officers, and she's very good at making sure everybody's wearing the right PPE, and the health districts have that. You will not be deployed without having the appropriate PPE to wear. I've only known of one volunteer, and it was very early on in the response, and she went and did some testing at a long-term care facility. And she's the only volunteer I know that has gotten COVID because of the volunteer response. And it was because they did not use PPE appropriately because it was very early in the response and we just didn't know enough. But the good thing is we know enough now and we know what works. And if we follow that, we know that we can be COVID safe and we can help our community. So when you do go, you are a volunteer. You know, we again recognize that you're available and sometimes you're not. You're going to be representing the MRC, so please wear your badge and your MRC shirt. In the winter, we might have vests that go over warm clothing if we're going to be outside. If we're going to be inside, we usually have polo shirts or t-shirts. You're welcome to wear any other long sleeve shirt underneath that, whatever makes you comfortable. Please make sure that you sign in and sign out. We have started doing some sign in and sign out using a Google survey link that your coordinator will provide you. But if you're in person and there is a sign in and sign out sheet, we ask that you do sign in and sign out so we can document your hours, but we can also make sure that you're safe. Should something happen at the event, we can account that you were there. There are job action sheets and just-in-time training. Please also make sure that you wear the appropriate PPE and that you have gotten fit tested for that. We actually, when you completed your application, or you will complete your application, it does have in it, it asks if you've ever been fit tested, and it asks what type, what size mask, what type of mask, what model of mask, because not every mask fits everyone the same way. So every time you change a model of mask, you have to be refit tested for it. So that's something, you know, I have told several people, oh, I got my N95 from Lowe's. And I say, well, it probably doesn't fit you right because it's a one size fit all. N95 mask is kind of similar to wearing a pair of shoes. Not every size fits all. So make sure that you are well fitted with your mask. I can say there's, I don't know, you probably haven't heard of Colonel Moskoff, but he's a Marine, and he always says, Semper Gumbi. We must always be flexible, and I can tell you, this has definitely been a hurry up and wait. We're going to hurry to try to get prepared and get as many vaccinators on the roll as possible, and we might sit around and wait for the vaccine to get here. We might sit around and wait for us to get some guidance, the EUA, you know, whatever it is. Things will change. We know that, but we know that we're going to do the best we can with what we have, and we're going to do good work. And it's super rewarding. I just, you know, I didn't even mention, but since the beginning of our COVID response, and I only have information from March until the end of June, over 3,000 volunteers have done over 75,000 hours of volunteer service, and the value of that's $2.2 million. That's astounding. I mean, the governor just was astounded. The fact that we have so many community members willing to give that time, I think is definitely, my quote is never underestimate the willingness of a volunteer. And I think that you as a nurse and also as a school nurse helping your community and having a passion for children, you definitely have the heart to do the same. So here in summary of what I have is always remember that you're representing the Virginia Department of Health and the Medical Reserve Corps program. You will be activated when you are needed. Please make sure that you respond to alerts, that you only talk to the media if it isn't, only talk to media if it's coordinated and approved by your MRC coordinator or your public information officer. We'll have that account created for you and trained, and just be on standby for deployments. You know, you will get activated when you are needed. And you'll get those alerts. If you have any questions, please reach out to your MRC unit coordinator so that they can answer those questions for you. Email, text, phone, they should always be available to answer your questions. So what is next to kind of wrap up those steps? If you haven't completed your application, please go and do that. Tanisha and I will be monitoring the applications to make sure that they get submitted. We'll be conducting your background investigation. If we need any additional information, we'll contact you about that. When we get that together, we'll do our identification badge for you. So we'll get your badge printed. We'll provide online, get the training that's online. So get into train, take any additional training that you need to have, complete the vaccinator training. You will have to go into train to take those quizzes that I mentioned. And we have a specific training plan for you. And we'll provide the instructions for you on Thursday when you take that training with Janine. And just be ready to mobilize and be ready to be done when we're done. I think we'll probably be done with COVID-19 maybe June 2021. We'll see how quickly all that vaccine gets out. So thank you for letting me spend time with you today, for going over kind of the nuts and bolts on being a Medical Reserve Corps volunteer and the different things that it takes to be a member of our larger team at VDH. We so appreciate you. We appreciate what you do in non-emergencies, helping to keep our young residents of the Commonwealth healthy. And I'm glad that we've been able to create such a great partnership with at VDH, with the Department of Education, and Tracy and Joanna. We have such a good partnership and collaboration, and we're going to continue to do the best we can with what we have. We're certainly glad that you've decided to join us.